have one session left, and Dr. Silke Cresswell is going to be talking about the BC Brain Wellness Program and how you can get involved. And she is supported by Sally Stilling. And I think everybody will be relieved to get up and do some exercises, at least some stretches and so on with Sally. So I'll go ahead and invite Silke and Sally. Go ahead.
All right. Yes, good morning, everybody. Thank you for the kind introduction. Can you hear me okay? Can you see my slides?
It's good. It's good.
Perfect. Okay, so before we all get moving, I'll say a few words about the BC Brain Wellness Program and how you can get involved. And then Sally Stelling, our physiotherapist and lead of the exercise part of the BC Brain Wellness Program, is going to take over and get everybody up and moving. So the program really is to build a community of people for well-being for those living with chronic brain conditions, their care partners, that's really important because they often fall through the cracks, and the healthy aging. So when we talk about brain health, and this has been very clearly articulated in the previous talks, which I, by the way, really enjoyed, so it's very encouraging and inspiring to hear everybody. So brain health is emotional health, it is mental and cognitive health, it is physical health, spiritual, social health. So it really impacts and affects us, who we are as people, who we are as people in the context of other people, and really our entire life. We've seen this now numerous times. The prevalence of dementia is expected to rise exponentially, and of course there are already very significant numbers of people living with dementia. And at least at present, we do not have a medication yet to prevent dementia or actually slow down its progression. But there are very powerful interventions we all can do for brain health, and we all should do lifelong. And they have a very low risk of side effects, and they have benefits for the brain and the body. And when we look at those particular components, they're really life choices we are making for the most part. So it is things like, what do I eat? So nutrition, it is sleep, it is spending time in nature. And this particular background picture actually was taken in Van Dusen Garden. So it is really close to us and accessible. There's music and other art forms. There is learning and cognitive activity. There's, importantly, community and relationships. Hearing can play a large role, and vision as well. Mindfulness, stress reduction, exercise and movement, and of course also addressing risk factors that have come up several times this morning already, such as high blood pressure, diabetes, smoking, depression, high alcohol intake, etc. And what is absolutely crucial, and so in a way it is fantastic that we are going after Paul's Club and the Alzheimer Society, social integration and community are absolutely crucial for happiness and longevity for anybody. Loneliness kills is as powerful as smoking or alcoholism was the verdict from a decades-long study, the largest one on adult development that was still is being run at Harvard University. So what is the BC Brain Wellness Program? It is one of the flagship programs at the Javad Morafagian Center for Brain Health, which we see here on the left, and it is in collaboration with the Alan McGavin Sports Medicine Center. And what we were thinking in our beautiful building at the Center for Brain Health, we have clinicians, we have scientists, all of us being dedicated to brain health. And then, of course, we have the brain users coming in. And very frequently, brain users come in to have their appointment and get told what to do, which medications to take, and basically told probably to exercise and to eat well and to sleep well. And then they are sent on their merry way until maybe half a year to a year later, we repeat the entire procedure. But we're not really in touch in between all that much. So what we're aiming to do here is to bring the brain users into the building and, more importantly, into the process of taking care of themselves as well as their brains. being actively involved in forming the program and being in much more direct communication with the clinicians and scientists. So our goals and missions are, of course, the patient-centered clinical care, and to really make these well-being, these lifestyle choices part of how we manage dementia and other brain disorders. Prevention is another topic I'm really passionate about, and I'm very encouraged to see that Dr. Clark-Funnell will give a topic on that specifically later on. Research is an integral part of the program, and that makes it different from other programs that would mainly provide services. Research here is integral to its mission. Education, both of the public, of patients, their families, but also of the next generation of healthcare providers as well as of scientists. We've got occupational therapy students, we've got physiotherapy students, we've got kinesiology students, we have medical students, we've got neurology residents, we've got neuroscience students. So we've got a whole range of the next generation who are incredibly motivated and passionate about the program, and they're contributing on many levels. Community engagement, so we're a very young program, but we're very interested in collaborating with the different societies, with the different programs, learning from each other and working together. And we're working at establishing and deepening those relationships. Interdisciplinary collaborations, and we'll have a look at the next slide as to who's currently involved. And then again, very important, the creation of community on many levels. So who is currently involved? So it is first and foremost a collaboration of UBC with Vancouver Coastal Health, so the health authority, and then we have the School of Music involved. We've got physiotherapy, the School of Physiotherapy, the School of Occupational Therapy, sports cardiology, social sciences, brain-related charities, other universities, community organizations, so anything from the, for example, had events with the UHealth High School Choir, neuroscience, of course, neurology and psychiatry clinics, sports medicine. So it is a very varied and interdisciplinary approach. We launched on October 5th last year, so we're really very young. And you see us all here with our t-shirts, proudly wearing them. And since October 5th, we have constantly increased the amount of classes we're offering. And I am extremely grateful to our most generous donors who have made it possible, have made the program possible, and then have made it possible to offer these programs for free. And this is really completely donor-based, and there have been some very generous visionary people who say, look, this really needs to be, we need to change healthcare. We need to make it a much more rounded approach. We have to have things like exercise, nutrition, sleep, social relationships in there. And so what's going on? This is a very busy slide, and it's busy because there's so much going on. There is a large and very important exercise component, and Sally Stelling will speak to that in a minute. We have yoga, which of course is also exercise. We have mindfulness classes. We have a book club. We've got improv theater, which has been very enjoyable. We've got arts for wellness, so visual arts. We have a talk cafe to just connect over a cup of coffee. We've got an outreach program that is based on mostly telephone outreach for those who don't have access to a computer. We're having a Living Your Best program, which is a group program which essentially coaches people on how to live your very best with a chronic health condition. We have occupational therapy programs, so things like how technology can help living your best, driving issues, etc. We've got a very active music program. We have focus groups with patients and care partners who are working as part of the Brain Wellness Program to give feedback, to bring ideas to the table. We have one of our volunteers is running the book club, for example. And then we have Wellness Wednesdays, which are the first Wednesday in the month, and they focus on different topics, so around brain wellness. So we had music, we had exercise, we had social connection, we had storytelling, We'll have Living Your Best in Times of COVID-19. And in June, actually, we'll have Dr. Hakon Nygaard be part of the program on cognition. Similar, but much, much shorter, like a mini version of today. All of this moved online very quickly when we couldn't meet in person anymore in March. So everything is online now. And before Sally starts talking about the exercise, I'll just talk to you about how you can get involved. So it is by self-referral, or you can be referred or recommended by your clinical team. You go to the website, and I'll show you that in a second. Who can join? People living with chronic brain conditions, their care partners, and then for quite a few programs, we can just also have people who are brain users, so essentially healthy aging. This picture obviously was taken before COVID hit us. This is a screenshot of the website. That's what it looks like. So there are these different programs here. You click on the Find Out More button. You'll find the website very easily by just typing brain wellness or BC brain wellness into your browser, and it will come up usually as the second from the top. You click on the Find Out More button, and that is where you get more information and also the registration page. And I will now hand over to Sally to talk about the exercise component. Sally, over to you.
Thank you, Silke. I'm not sure how to get myself in there.
That's a good question. Maybe you speak to it and then we change. Once I'm done, we change completely and then you're in there.
Okay, can you hear me talking? And can everyone hear me?
Yeah.
Yes, okay. Hi, everybody. So my name is Sally, and I'm the physiotherapist working with the BC Brain Wellness Program. As Silke mentioned, classes initially were done in person, and then we quickly had to move to doing it virtually via Zoom. We're now up to 6 classes a week with about 15 to 18 people in a group. Assessments are necessary. I do one-to-one assessments with every participant, also virtually, just to determine what level of exercise is appropriate for you and which group would be a best fit for you. Exercise, there's a growing body of evidence to show how significant exercise is and how it can impact all these different risk factors. Intensity matters, and that is also why we need to do the assessment. So we need people to be exercising to the point where it's uncomfortable and challenging, but not to the point where it's dangerous. So, hence the collaboration with cardiology as well. We're looking at different components of exercise. So we incorporate aerobic exercise, strength training, functional body movement, balance retraining, and flexibility. So they're quite varied. The other unique piece to the exercise programs is we do incorporate brain or cognitive tasks simultaneously to exercising, which we'll practice in a bit, such as counting backwards or word finding whilst exercising. There's a growing body of evidence to show that that is helpful as well. So the exercise program is founded on science and research, and we are really looking at doing best practice and following what the current guidelines are. And there will be research coming, and it's largely founded, and the foundation is research-based. So we're trying to figure out what is the best and what works the best. And I'm pretty sure it won't be a one-size-fits-all answer. So thank you very much.
Thank you, Sally. That's great. And of course, we'll have Dr. Philip Lee talk about the science behind all of that quite soon as well. So that's great. And so whilst Sally gets ready to get us all moving, here is the website again. And again, a major thank you to our donors who make this program possible. You can sign up on the website also for our newsletter and the mailing list, so you can always stay informed what's going on, and we'd love to hear from you. And with that, I will hand over to Sally.
Okay, Hi, everybody. Can you see me? Am I on your screen?
You're on, Sally.
I'm on. Okay, good. Okay, so this is me. I was talking just now, so now you can see a face and attach a face to a name. I see there's 238 people online. I'm kind of glad we're on Zoom because I think I'd be a lot more nervous if I had to do this in front of all of you. So right now, I can just do it and pretend I'm by myself. So this is where I teach the Zoom classes. I'm in my living room, and we'll just get going. So firstly, please don't do anything that you feel unsafe doing. Only do what you feel comfortable doing, confident doing, and safe doing. As the exercise is not one size fits all, and we just need to get moving. We've been sitting for a long time. In the interest of time, I will just start and give myself just a few minutes here. So if everyone can get up and standing, if you're able. If you cannot, you can stay in a chair. So can you still hear me, Lynn? Am I good?
It's good.
Okay.
Everybody's ready to stand up.
All right, everyone can stand up. If you can't stand up, or if you need to hold on to a chair, have a chair nearby so you can hold on to it for balance. So we're just going to start off by going down into a little bit of a squat. Up, touch your shoulders, and reach up into the sky. So down, shoulders, and reach. And down, I'm just going to tilt my screen a bit. We'll go down to touch the shoulders, reach up, touch the shoulders. So down, touch, and reach. When you're doing a squat, always remember to stick your tailbone out behind you, weight going through your heels, and keep your chest up. We're just going to do 5 more of these. 4, stretch those fingers up. 3, 2, and 1. Right, now just marching. So we're just going to march on the spot. I'm just going to turn side on so you can see me lifting your knees up, driving the elbows back so you're using your arms in a reciprocal pattern. So opposite arm, opposite leg. Now we're going to go 1, 2, 3, 4, 5. Try and hold in balance. And march again. 1, 2, 3, 4, 5. Hold in balance. Do that 2 more times. Hold in balance. And 1 more. Hold in balance. Right. Now we go from the beginning again. So squat down, shoulders reach up. Squat down, shoulders reach up. 2 more. And last 1. And marching. 1, 2, 3, 4, and hold. And balance. 2 more. Now you know what you're doing. Now we're going to add the cognitive task with it. So as you're doing this, you're going to count backwards in 2s from 101. Okay? So 99, 97, say it out loud, and march. Keep going. Remember those knees up high if you can, 4 of each thing. And keep counting. 1 more time. Down, shoulders reach. Down, shoulders reach. And march. 1, 2, 3, 4. Hold and balance. Right, now stop counting. And now you're going to name vegetables from A to, fruits or vegetables from A to Z. Same movement pattern. So apple, banana, carrot, dragon fruit, eggplant. Keep going. Keep doing the exercise. Try to remember the pattern. Hold and balance. Hold and balance. Last one. And we'll just keep it, we'll stop it there with that one. That was just 3 minutes. So I have a couple more minutes to do a few more things. So let's just start with the arm circles. So that gives you an idea of the dual tasking. We're doing big arm circles, both arms going back at the same time. I'm going to tilt my screen a little so that you can see the top of my arms. Right, now you're going to start with your arms up top. You're going to take one arm back and the other one forwards. And stop at the top. And one arm back, the other one forwards. 3 more. You can stop naming fruits and vegetables, or you can keep going. Hold it there, and now switch the other way. So now you take the opposite arm forward and the other one back. Good. And one more, opposite, forward and back. All right, and now I'll come closer to the screen. At least you've got a little bit, moving a little bit. That gives you a little bit of an idea of the exercises. The other thing we work on as well is some sort of more fine motor skills. So we can all start with this. If you were standing or not standing, you can do this one now. Start with your thumbs up, put your thumbs down, then stick your pinkies out. Pinkies in, thumbs up, pinkies out. Not too hard when you do it the same on both hands. Now thumb on one hand, pinky on the other, and switch, and switch, and switch, 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 switch. It took me a while to get this. I had to practice. It was difficult. So that's some of the other just small fine motor exercises we do. Before I finish, I have just 30 seconds left. Let's just all do a deep breath in. So take a deep breath, breathe in, reach up, hands up above your head, and release. Blow the air out. Link your fingers and push your hands away. Just stretch between the shoulder blades. And come back up. And last one, push away. And come back up and shake it out. And I will hand it back to you, Lynn. And thank you everybody for participating. And the details on how to sign up was on the Brain Wellness website. For the exercise program, you do sign up for a one-to-one assessment first, and then we get going with group classes. And as Silke mentioned, it's open to caregivers as well. It's been a wonderful program for partners to participate together and feel like they're doing something together to improve their health and well-being. So thank you for having me.
Thank you very much, Sally.